Hello, everyone. Welcome to the Epidemiology and Community Health Seminar. I'm so pleased that we're here to host Representative Ruth Richardson today. But before we begin, I just have a few quick announcements. The first is about our seminar next week, where we will be hosting Dr. Sean Phelan from the Mayo Clinic. Sean is an alum of our PhD epidemiology program, so it'll be great to have him back. He'll be speaking about weight bias, specifically in the clinical setting. So I hope you can join us then as well. In addition, as you may know, this is the second of a series of community engagement seminars that we have here in the division. Last week's presentations were fantastic, and we had a lot of interest and conversation, and so we would wish to continue that today. As such, Jeff, would you mind showing the slides, please? This is just a reminder to faculty and students, the university community, that community engaged work here is taken very seriously. And so we have, if you could scroll up, please, several grant opportunities. Grant opportunities for funding for community engaged work. If we could scroll, to the left, maybe. Well, we'll drop this link in the chat box for you. My apologies, but this is the link of grants that we saw last week, and they're internal grants. They have a wide range of funding mechanisms as well as grant levels. So should you have an interest in pursuing a grant or research opportunity here, please don't forget these types of mechanisms. Another advantage to these internal awards is that they are commonly a lot quicker to get than other sources of funding. So please do consider these. Once again, we'll drop this link in the chat box for you. The other thing that's included here is the list of seminars related to equity, diversity, and inclusion that the Center for the Center for Education Innovation has throughout the year. We've listed the fall 2021 opportunities that might be relevant. In addition, they are fantastic with regards to having people come in to your course and or counseling you as an instructor on these issues. And again, this is one of the primary aims of our seminar series, is how to better translate what we hear here on a Friday morning into our classrooms and through our students as they grow and mature into public health professionals. And we'll be speaking about that some today as well. And then lastly, the new slide here from last week is something that the faculty may be thinking about. So a lot of questions revolving community engagement have to do, for faculty, may deal with, well, you know, how do I portray this hard work in my dossier as I think about progressing in my career in order to do more good work? And so the Vice Provost has started these series in which they will help us better create a dossier that will reflect the hard work that we're doing with community engaged work. And so there's one coming up on October 19th, and the information again is in the slide set that we'll be dropping into the chat box. So without further ado, I'd like to introduce someone who I've known for years, and I am so very pleased that she's taking the time to spend with us today. This is Representative Ruth Richardson. Ruth is an alum of the University of Minnesota. Her high achieving ways were very apparent even as a young person. She double majored in both history and sociology here from the University of Minnesota. And then she went on to earn her law degree from William Mitchell. From there, she served the city of Minneapolis. By the way, my apologies. I'm going off the top of my head. Okay, I finally got my screen. As my students will tell you, I'm not very technologically advanced, and we're having some issues this morning already. But Ruth went on to serve the city of St. Paul, rising to the position of the Deputy Director of the Department of Human Rights and Equal Economic Opportunity. From there, she joined the Minnesota Organization on Fetal Alcohol Syndrome, now known as Proof Alliance. And since July of 2019, she's been the CEO of the Wayside Recovery Center. In 2018, again, showing her high achieving ways, Ruth was elected to become the representative in the State House for District 52B. In her first 3 years as a state representative, she's become the chair of the Education Policy Committee. And she also sits on the Education Finance Committee, as well as the Transportation Finance and Policy Committee and the Commerce Finance and Policy Committees. In her 3rd year as a legislator, she's already chief authored over 30 pieces of legislation. And I'm just going to highlight 3 that our group may be particularly interested in. And those include the healthy development of babies during pregnancy and postpartum, a grant for Black, Indigenous, or people of color and families, funding provided, and money appropriated. Another has been the Dignity in Pregnancy and Childbirth Act, which was established, anti-racism training and implicit bias continuing education, and allowing for the Commissioner of Health to expand maternal death studies to include maternal morbidity, and money was appropriated for that as well. And then lastly, she chief authored legislation calling for the prohibition of the dismissal of students in kindergarten through grade 3. So it is a great pleasure to welcome Ruth today. Thank you so much, Ruth. And Ruth is going to begin with a presentation on Wayside Clinic. And what we're going to do today is have an informal discussion. We've got some questions ready for Ruth, but I also will be inviting you to simply unmute and ask a question of Ruth and her expertise. So welcome, Ruth.
Thank you so much for that kind introduction. I am going to attempt to share my screen here, and hopefully we're able to get this showing with no issues, and very excited for the opportunity to be able to present to you all today and to share a little bit about Wayside Recovery Center, and to also talk about some really timely policy issues as well. So a little bit of background on Wayside Recovery Center. This year we are celebrating 67 years. The organization started 67 years ago through the vision of our founder, Sally DeVay. Sally was a door-to-door makeup salesperson. And what she described, what she experienced as she was going door to door to sell cosmetics, she talked a lot about the experiences that she was seeing with women. She described women who were experiencing domestic violence, women experiencing homelessness, substance use disorders. And she described these women as being left by the wayside of society. And so our organization was born 67 years ago out of her vision. And when it began, we started that first year serving 7 women with a shelter. Fast forward to today, we serve over 700 women a year and over 300 children. So a little bit of background on the services that Wayside Recovery Center provides. We provide gender-specific inpatient residential substance use disorder and mental health treatment. So we are what is called a co-occurring program. So the women that come to us come with pretty complex histories related to addiction, to mental health, and the vast majority have experienced significant forms of trauma. In St. Louis Park, we have an inpatient residential facility where women can come. In Minneapolis, we have a very unique and innovative family treatment program. And what this family treatment program program. We were the first in Minnesota to start a family residential program where moms could come with their little ones to treatment. What we would oftentimes hear were the barriers that would prevent women from coming into treatment that related to concerns around their children. And so with that program, we have the ability to not only serve mom, we have the ability to provide services to the little ones, including children's mental health services. And we also have opportunity to engage other family members, because we know when one family member is seeking treatment and is beginning on a recovery journey, that entire family is impacted. So we create pathways for partners, boyfriends, husbands, to be a part of that journey as well. On the screen, you'll see just a few highlights from our 2020 annual report. And one of the most important things that we focus on as an organization is ensuring that families can remain unified. And that's why we really do quite a bit of support within our family treatment programs, because we know families do better when they have the opportunity to stay together and to stay unified. In addition to our inpatient residential programs, we also have outpatient programs that are scattered throughout St. Louis Park, Minneapolis, and also in St. Paul as well. And we have a permanent supportive housing program in St. Louis Park, where families can stay with us as long as they need to get secure in their recovery, secure in their sobriety, and also to get secure financially as well. We know that issues of addiction, issues of trauma, issues of mental health are complex. And so we really focus on providing an integrated type of service delivery within Wayside. This slide just shows some of the continuum of care that we provide. I've talked about some of our inpatient programs. We also have a standalone mental health services program that provides services to both adults and to children as well. We have integrated primary care services into our programs as well. So it can really be a one-stop shop for families, and it reduces the need to use emergency room services and also urgent care services, because with the care that we can provide on site, we can not only address some of the primary healthcare needs, we also have the ability to address some of the urgent care needs that are available as well right on site. We have psychiatric services. Those are new services that we are now offering as part of our integrated care. And one of the things that I'm most proud of is our new dental services as well, because we know that health is holistic, and to be able to have on-site dental services for our little ones and for their parents and for other women that we are serving as well has been a huge benefit and support for our families and individuals that we serve. Wayside Recovery Center is also on a new journey as well. We are undergoing a pretty significant expansion. We were awarded a grant through SAMHSA, the Substance Abuse and Mental Health Services Administration, back in 2020 to develop a certified community behavioral health clinic. And as part of that behavioral health clinic, those new services that I just spoke to you about in terms of that integrated care has really been a focus of that expansion. It's also allowed us to increase our offerings of MAT services, or medication assisted treatment services. And we have a pretty steady flow of patients and clients that use those services. And typically on a day that we have our clinical services available, we're seeing about 10 patients a day, about three times a week. In addition to the certified community behavioral health services that we see as an enhancement and have the ability, I think, to really be transformative, we have a new outpatient center in St. Paul, our wellness center, and we offer same-day access to crisis services out of that location. And we've been working to really ensure that same-day access to crisis services means same-day access. Right now, the federal government definition of same-day access means an appointment within 10 days. We thought that that was a little too long, and so we set a goal of seeing the vast majority of patients in need of those same-day access crisis services on the same day or within a 3-day period. And our goal is to continue to move that needle so that same day truly means same day access. Wayside also does a lot of partnership within the community as well. And one of the new sort of collaborations that we're really excited about is our Center of Belonging. So this is really built on testing a model that we think might be able to be replicated across different communities. So Wayside has partnered with a number of different partners on the Center of Belonging. We've partnered with the faith community as well, and Resurrection Church in South Minneapolis had this overflow of space that wasn't being used throughout the week. And so with a lot of conversations and a lot of community engagement and collaboration, we developed this Center of Belonging concept where there truly is a one-stop shop for community right now in South Minneapolis. We renovated the basement of Resurrection Church, and we now share that space with other providers who are providing after school services for youth. There's a food shelf for those who are experiencing food insecurity. Employment services are on site. Mental health services are on site. Addiction services are on site, and a drop-in childcare is as well. And we are really excited with this model, and there are already efforts underway to replicate this model again in other places within the state of Minnesota. So this is just sort of a final slide to let you know that you can always get in touch with us if you have an individual that you'd like to refer to our services. And you can also get in touch with us if you're interested in learning more about Wayside or have questions around different ways of being able to collaborate as well. So thank you, Ruby, for the opportunity to talk a little bit about Wayside at the top of this, and happy to stand for any questions.
Well, we're so happy to have you. Let me begin with one question, and then we'll open it up to the audience. Ruth, do you see that there are ways that the existing public health system is actually a barrier to women seeking recovery services?
That's a really great question. And there are so many barriers to women and men, individuals at large, in terms of thinking about being able to access services. And when I think about ways that we can sort of break down those barriers and improve the ability to access, I think that we really need community-based responses to that. And that's where I think that intersection with public health becomes so important in many ways. One of those ways is about building systems that are about access. But another really important, I think, opportunity for public health as we think about the needs of community-based participatory research. I think there's so many opportunities to be thinking about how we can be working together to build really effective and evidence-based models moving forward. Sometimes it can often feel that in terms of those who are doing the day-to-day work, it can feel very disconnected from what's happening on the research front. And it can also feel very disconnected from what's happening with policy. And from my experience within the legislature, what I think builds the best case for moving us forward to address barriers and to address disparities is when we're able to have those who can bring forward the voices of real life experiences and real life stories, but then you're able to also have that leveraged with the data. You're able to have that leverage with evidence-based research and evidence-based suggestions for how we move forward. That's where I think there's a lot of opportunity to have better connection and better collaboration to get better outcomes.
Thank you. Dean Finnegan.
Thank you very much, Representative Richardson. Really appreciate your presentation. And I've got a kind of a larger question. As you're probably aware, you know, the Minnesota legislature, like many states, has disinvested in common goods over a period of time. They've disinvested in higher ed, they've disinvested in public health. And do you see in the period that we're in, where we have the collision of such important public health emergencies, some of which you certainly have addressed in your presentation, do you see an opportunity for coalition building that could turn that around in some way? I'm thinking, you know, we're just not investing in human thriving, and that's really, I think, central to so much of what's broken in our society and really needs to be addressed. But you know, I think all of us in public health are trying to stay optimistic that we can do that, but I think you have to get down to the hard work, and I'd be really interested to know what your feelings are about that and about how we might move that forward.
Yeah, I think there's tremendous opportunity right now to really build new alliances. I sometimes call them co-conspirators within this work, to really begin to build the case in order to address that level of disinvestment. And I think it's also really important when we think about where we're investing our dollars, and people often talk about our budget is really a moral document because it tells us what we value, what we think is important. And you know, we can talk about disinvestment, but we also have to talk about communities that have never really been invested in as well. And so as we are looking forward to like this next legislative session, and within continuing to be within this really unrelenting pandemic, we're having conversations at a policy level that I don't think really have been had at such an extensive sort of rate in the past. Last year, you know, faced with the COVID pandemic, the brutal murder of George Floyd, I was able to move forward a House resolution declaring racism a public health crisis. And as part of that resolution that moved forward from the House floor, and it passed off the House floor with bipartisan support, we created the House Select Committee on Racial Justice. And with that House Select Committee on Racial Justice, we worked with legislators on both sides of the aisle. We worked within community, and we developed a report that was really built out of the voices of those in the community that were closest to the pain of the issues that we were discussing, to really set a roadmap for future legislative action. And that roadmap, we were able to get a number of those bills successfully passed into law this session. So I think that there is we should definitely have hope that there are things that we can do differently when people come together to have these conversations. And so much of what we're talking about when we're talking about public health, when we are talking about the impacts of systemic racism, these are issues that are oftentimes not as polarizing of issues in terms of thinking about how do we have the most healthy state possible. So when we think about improving public health, you can talk to any elected official and they're going to tell you, we want Minnesota to be the healthiest state that it can be. And I think that there is a real opportunity as we look at things with those lenses, those intersectional lenses, to educate folks that if we're not addressing the social determinants of health, if we're not addressing the impacts of systemic racism, we're not going to be as healthy of a state as we could be. We are not going to be as prosperous of a state as we could be. And being able to pull forward with that data, because systemic racism is expensive. And when we look at the total cost of lost resources, the city research that came out in 2020 that looked over the last 20 years at just discrimination against Black people in the United States, the estimates are that we lost $16 trillion as a nation, just looking at discrimination against Black Americans. And that's not including any other groups that experience discrimination or systemic racism as well. And so I think there's an opportunity to build those collaborations, to come with the data, and then to be able to use that information to make real policy differences that will actually move the needle in the right direction.
Thank you. That is very helpful. One just real quick observation. I know others have questions, but I wonder. Sometimes when the governor and many others, put together these blue ribbon panels that really talk about the future. I mean, this is an opportunity for us to do that. I note that Minnesota's ranking as a healthy state, and of course, that refers mostly to white folks because people of color, Black, brown, and indigenous people are actually much less healthy here compared to their white counterparts than would be true in many other states. But thinking about that, I mean, I just wonder if that kind of concept, that very large, powerful coalitions from across the state, we are declining in the health in the state, everybody, white folks included. And it just seems to me that it's time to call a halt to this because so many of these systems just seem broken to me. But thank you very much. I don't think you have anybody on this call that will disagree with you on what you proposed. Appreciate it.
Yeah, and I think we do have a real opportunity here. And as I think about all of the different systems that are implicated in what we see in terms of either inequities or what we see in terms of disparities, we have systems that have been built in a way that the outcomes that we are seeing right now, they're not surprises. They're predictable outcomes that are based on the way that our systems have been designed. And our systems are working just the way that they have been designed, to work. And so I think it's really important as we think about how we rebuild systems, an important piece of that when we think about blue ribbon commissions or collaborations to have these conversations is how do we build a table that ensures that the voices of individuals who are are bearing the brunt of those inequities and disparities are centered, because so often there are those from the outside that come in and say, well, this is what we think that you need, or this is what we think will be helpful. And so it is always, it's always great to be with those who see the value of really having those strong community connections and collaborations.
So Ruth, your conversation with the dean absolutely answered my last question, which is how do we move forward together to make a healthier Minnesota? But one of the aims of this seminar series is to really talk about the ins and outs of how to do so. So the sausage making of this all. So when you say that we should collaborate, and you being, and I wonder if you consider yourself a public health either practitioner or public health ally, but how best for us to collaboratively work together to make those changes? We being in public health and you being with Wayside in that capacity, but also as a legislator.
Such a good question. And I'm going to answer it from two ways. I'm going to answer it with the Wayside hat on, and then I'm going to answer it from a legislative lens. So when we think about the impacts of the COVID pandemic, I think everyone here knows that the inequities and disparities didn't start with 2020 with COVID, that those were pre-existing. And we saw gaps widening. We saw that we're really moving the wrong way. And looking at the data from 2020, opioid overdose deaths increased 27% last year. 27%. And we've heard a lot of that in terms of that statistic, but what we haven't heard about is how those overdose deaths played out with the intersection of race. And what we know is that when we look at the data, Black Minnesotans, Indigenous Minnesotans, white Minnesotans, they use opioids at pretty similar rates. You don't sort of have this, well, if you're Indigenous, you're more likely to use opioids, or if you're white. It's like the rates are they're pretty similar right now in terms of who's using opioids. But when we're looking at the overdose deaths, there's disparities, because we see that Indigenous Minnesotans with opiate use disorders are 7 times more likely to die of an overdose. And when you think of them being 7 times more likely to die, and then you think about what our population demographics look like, when we see these huge outliers for Indigenous individuals and Indigenous families, and we think about the sort of the small segment of our population in terms of census that they make up, it's even more alarming when you think of that 7 times more likely. Black Minnesotans, twice as likely, 2 to 3 times more likely to die of an overdose. And so I think that as we begin to think about like how we connect and how we work together, there's a real need to focus our efforts where those disparities are deepest. Because the one thing that I know for sure is that if we improve outcomes for Indigenous Minnesotans, and if we improve outcomes for Black Minnesotans, everyone's going to do better. Because when you're thinking about those deep disparities, if we're supporting that, we will see individuals do better. And the unfortunate history and reality of our responses to the substance use disorder crisis within Minnesota, within this country, is that it's been raced and it's been gendered. So you have right now, we hear a lot about the need for support around the opioid crisis, but 30 years ago, when there was a crack epidemic, the response was not about support. The response was not about, how do we build systems of safe care? The response was punishment and separation of families. And because of that response, we are going to be consistently 30, 35 years behind where we could be in terms of building like evidence-based systems of support, helping individuals getting on a road to recovery, keeping families unified, because we know that the disparities that we see in out-of-home placements, again, Black and Indigenous youth are more impacted by that. So I think as we're thinking about ways from a Wayside perspective, I think that there are opportunities for the public health field to really get invested in those social determinants of health, and really thinking about how do we support those who are bearing the brunt of those disparities. And as we think about like where we are putting our time and research, how are you interacting with community to determine what those priorities look like? Are those priorities determined behind closed doors with everyone wearing pretty similar hats? Thinking of ways of engaging and reaching out from that. Now, from a legislative piece, I think it's really important that people know that the state capitol is your house. I think oftentimes people think, well, that's that thing over there that doesn't really have anything to do with me, but it's like the work that happens there has everything to do with you, everything to do with your families, and everything to do with what you want to see happening. Minnesota is unique because we are the only divided legislature in the nation. We have a House that is Democratic controlled. We have a Senate that is Republican controlled. And so that makes for some very interesting policy conversations. But what really moves people on both sides of the aisle is hearing from the people who are, constituents. Because you can talk in an echo chamber all day long, but when you have the ability to really be connected with community and hearing from community about what's really important, I see people move along that continuum very often. And so the ways to really think about like what's happening at the Capitol and where you can engage, the first thing is reach out to those who represent you. Reach out to them, share with them what's really important, ask for meetings. People will meet with their constituents, so asking for those meetings can be really important. If you're building coalitions, having a constituent reach out and being able to bring a group of coalition folks with you is a good way to also get in front of people and to get further upstream. So before session even starts, like having those conversations, building those relationships, because so much of what happens at the Capitol is about building relationships. There are some lawmakers who spend a lot of time working on drafting bills. There are some lawmakers who spend a lot of time with community, and those community-driven ideas are then being pushed forward. Anyone can come with a bill idea. Only a legislator can drop it, but you can be building relationships, and you can be building the ability to encourage people to do things. And then when we get to the legislative session, attending committees, testifying at committees is a huge way to also get involved, or getting involved in different like letter writing campaigns, letters to the editor. There's lots of different ways to get involved depending upon how much time you have and also your comfort level.
Thank you. I invite audience questions.
So I see one is in the chat. Do you have advice for researchers embarking on community-based participatory research on how to build equal, trust-based relationships with community-based groups? And that's a really I think that's a really important question, because when we're thinking about some of the deep needs that our state has from a race equity lens, we also know that research has not historically been kind to Black and brown bodies within the United States. And so that can also create some of those barriers to being able to have those trust-based relationships. But I think one of the most important things that you can do is to spend time in community and talking to people. And so any ways that you can begin to make those connections, and make those connections further upstream. Don't make connections when it's like, okay, I've got to get this thing in a week or 2 weeks, because that doesn't feel as effective or genuine. And if there are ways for you to be able to engage community at the earliest point of thinking about going on that journey of doing something that's going to be focused on being community-based and participatory, to help individuals build out what that looks like, I think that's one of the best things that you can do to build trust, because then it's not about you, it's not about the institution, it's I'm coming to the community, and I'm coming not saying this is what I think you need. I'm coming open to say, what do you need, and how can I help you? How can I help you get there?
Thank you. Diane.
Hi, thank you so much for this wonderful presentation and being open to our discussion. I'm Diane Newmark-Steiner, and I chair the Division of Epidemiology and Community Health. So listening to you talk the way we talk about social determinants of health and everything else you were saying, it's just music to our ears, just so you know, it's really, really appreciated. So many of our faculty and our students care deeply about these issues and want to work more closely with communities and with the legislature. So I'm kind of building on what Ruby and the Dean were asking you, but I'd like to know specifically, how do we make context to let you know what we're doing, to get support for what we're doing, to find out how we can be of help with what needs to get done?
That's a really great question, and I will. I'm going to give you the lawyer answer. It depends, because as you're reaching out to elected officials, the things that are going to catch their attention or capture their attention is going to be different for each of them. And so I can share from my experience when I have either groups that are coming to me or individuals that are coming to me with ideas. You know, some of the questions that I ask when they're thinking of, hey, we want a partner, and here are some things that we need support on. So typically, if there's a coalition that is coming to me and saying, we want to work around a certain specific issue, I'm going to be asking them questions about, well, who have you worked with? Who have you engaged? Who have you worked with in community? Because for me, you know, one of the promises that I made to my constituents when I made the decision to run for office was that I was going to keep the real life of experiences of people at the center of the work that I'm doing. And if we're exploring something, I want to make sure that we are engaging those who are closest to the issue. And that means like not only like closest to the pain of the issue, but also individuals who are genuinely invested within the outcomes. And so I spend a lot of time sort of asking those questions to really try to see and understand if this is something that is really being community driven versus this is something I'd like to do to the community. So that's something for me that's really important when I think about like what those collaborations will look like. And sometimes people reach out around different bills that I might be carrying and saying like, hey, how do I get to be part of this work? And how can I join in on this work? And a couple of the examples that come to mind for me is around the Dignity in Pregnancy and Childbirth Act. Lots of stakeholders from lots of different places were really interested in engaging around that. And so we would have periodic Zoom meetings where we would have individuals who lost family members. We would have individuals who had experienced a morbidity or a near miss who had almost died themselves as a result. We had healthcare providers, we had researchers there, we had midwives, we had doulas. So we really pulled together this really strong collaboration of people who didn't always agree. I mean, we had some very interesting and just tense discussions around how do you define morbidity, because not everyone was coming to that with the same lens in terms of like what's severe morbidity and what's not. But what came from that was a real opportunity to create relationships with people who don't always talk to each other. So as lawmakers, I mean, I think that's one of the best gifts that we have to give to community. We have the ability to convene folks from the community and also various stakeholders as well. So I can answer it from my perspective. That is something that really moves me. I will say that for some other legislators, for some, the stories are the most important thing. So like hearing directly from people who are impacted is what really moves them. Other legislators, it's, I want to see the data. What does the data say? What is the evidence saying that we should do? So part of it is being able to do some of that homework behind the scenes to try to get to know a little bit about what might move a particular legislator. And those committee hearings can be great clues.
Thank you very much. Any other questions? So while we're thinking of more questions, Representative, I think other people in this group will agree with me that we are really striving hard to educate and train the most diverse public health class yet to come. So one of the things that we've thought to do is to extend the reach of public health beyond my program area, which is the undergraduate program, and into the high schools and even earlier. As the chair of the Education Policy Committee, how could we come together to introduce public health more widely throughout the state of Minnesota?
Really great question, because we know when we think about how health is built, it's where you live, work, learn, and play, right? So education is such an important foundation for what later outcomes are going to look like. One of the bills that I am most proud of chief authoring and getting across the finish line was the bill that prohibits suspensions of preschoolers, because a lot of times people didn't know that preschoolers were like 3 times more likely to be suspended than kids K through 12. And so to be able to close that door on our smallest learners was huge. We were not able to get the K through 3rd grade suspension ban this year, but I think that is a huge opportunity right now for you all in public health to be able to engage around, because what we know in terms of the trajectory and outcomes for kids who experience school push out it determines so many other things that are going to happen that look at the overall impacts of the education disparities that we have. When you're pushing out kids K through third grade, they're probably not going to be reading at age level by age 8. And if they're not reading by age 8, there's a whole cascade of things that happen as a result of that. And those kids who experience a suspension or expulsion between kindergarten and third grade, they're less likely to finish high school. They're more likely to have involvement with the criminal justice system as well. And what we know in terms of what the school push out looks like, it's a very inequitable process because we have Indigenous students being 10 times more likely to be suspended from school or expelled. Black students are 8 times more likely, and students with disabilities are twice as likely to be suspended versus those without disabilities. And for Indigenous students that experience that 10 times more likely to be expelled or suspended, they make up 1.6% of the student population. So you make up 1.6% of the student population, but you're 10 times more likely to be suspended. That's a huge issue. So right now, we within our state, and Minnesota ranks among the bottom in terms of outcomes for Black and Indigenous students. And as the dean said up front, in terms of what we see for the data on health, we rank very high when we're looking at white Minnesotans. When we're looking at education, we rank pretty well when we're looking at white students. But when we bring in the reflection of the diversity of who we are as a state, we are near the bottom in terms of outcomes. So I really think that if we're really serious about closing the gap at a base level, children need an equitable opportunity to be in the classroom. And if we don't close this school disparity gap, we will never make progress on closing the opportunity gap. Some people call it an achievement gap. I call it an opportunity gap that we see within this state. And so there are ways to get involved. We have held, and I know I've held, and Rep. Moran, we've held roundtables on education equity issues. Please join those. If there are interests in getting in front of some of our caucuses, that's another way that you can express interest in working together. Our Black Caucus will have an agenda on looking at education outcomes. And so there are always opportunities to get in front of our Black Caucus or our People of Color and Indigenous Caucus as well. So again, so much of this is about relationships. I anticipate this fall, we'll probably see some roundtables around early childhood. So we have a new generation of kids who are starting kindergarten for the first time. And these kids didn't get the full effects of being in a preschool program. And we're now also seeing little ones who, because they were born during the COVID pandemic, they've had limited interaction with other kids. They've had limited interactions with adults. I was talking to one individual the other day, and they were talking about a newborn who only had interaction with 3 adults within like the first 9 months of their life. 3 adults. And so when we think about some of the evidence and the outcomes, I mean, even thinking about social skills, if kids haven't built those social skills by about 4 or 5, it is much harder to build those things later. So I anticipate there's going to be a lot of conversations that are happening around some of the early childhood challenges that we're seeing, because those kindergarten teachers who are getting these kids who haven't had what we would see as traditional immersion into kindergarten, they're describing them as being a lot more like toddlers than kindergartners.
Would anyone like the honor of asking the last question this morning? If not, I will. So I have had the pleasure of knowing Ruth outside of this seminar, and one of the most compelling stories that I had heard from her when we were just getting to know each other, when she was working with MOFAS, Minnesota Organization on Fetal Alcohol Syndrome, excuse me, was actually her own story. So Ruth, could you tell us, maybe we're moving backwards here, but could you tell us how you came to be this champion of what we would call champion of public health and defender of health equity for us all, and what experiences have led you to this?
Yeah, I think that I really believe that our politics are driven so much by our life experiences and our personal experiences. I grew up in St. Paul and Frogtown. My parents moved to St. Paul right before I was born. They were actually from the South, from Mississippi, and they came here in search of better economic opportunities, better educational opportunities, but frankly, they were also fleeing what was a very oppressive and terrorizing environment within the South as well. And there are a few things that I think I see as really defining moments within my childhood that got me on this trajectory of being a defender for human rights and a defender of advancing public health and of equity. And it was before I even knew those words. I didn't know equity. I didn't know about, about the social determinants of health. One of those issues and one of the things that has really led me to the work that I've done around addressing disparities in Black maternal health was hearing the stories of my own mother as a kid. So as a kid, we had this assignment at school of where we were supposed to tell our birthing stories. And I heard these birthing stories from like all these other students, and they were like these stories that were filled with like, funny, joyful, like, these light stories. And my mom was telling me these horrific stories of how she was treated when she had her first hospital birth. My sister's head had started to crown. The nurse was in the room. There were two doctors at the foot of her bed, and the nurse is trying to get the doctor's attention. And it's like, the baby is coming. And the doctor looked at my mom, and he was annoyed that his conversation had been interrupted. And he pushed my sister's head back into the birth canal. And my mom said that that was the worst pain that she has ever felt in her life. And she said, if I could have gotten off the table at that time, I would have retaliated. If I had retaliated, I probably would have died. So that pain saved my life that day. And when she told me that story, I was thinking, that was horrific. That happened to you? And like, I can't believe that happened. And she said, well, it happened to Black women all the time in Mississippi. It happened to my mom. It happened to my sisters. When it happened to your Aunt Katie, the baby didn't survive. So hearing those stories, seeing how individuals were treated during the crack cocaine era. My mom opened up our house because she didn't want kids to be disconnected from their community. We had over 30 kids that were in foster care that moved through our house during that time period, be it because of kinship, because they were actually family members as well. She was really a visionary, and she knew how important it was for kids to be connected to relatives, to kin, and to be able to have support to try to keep those connections going, because those lost stories and those lost histories are utterly traumatic and raise ACE scores. And we didn't know what ACE scores were then, but we knew that these were things that wouldn't be helpful. So, I mean, those are just sort of two of the defining stories that got me to where I am today. But so thankful for the opportunity to be able to be working on these issues within the state right now.
So Ruth, I am absolutely in awe of the work that you've done outside of the legislature as well as in its ranks. And I look forward to seeing more of you as it relates to public health. So thank you for being a champion for us. And I'm sure you'll be hearing from us about working collaboratively. So
I would love that.
wonderful. So I'm sure everyone is joining me in a big, huge thank you to you. Thank you, Ruth. And for the rest of you, we'll see you next week. Bye-bye.
Thank you.
Thank you again.